Good afternoon, everyone, and thank you for joining us today. With me is Dr. Deena Hinshaw, who is going to be providing an update on the COVID-19 situation here in Alberta, and as well Dr. Verna Yu. And Dr. Yu, of course, is the president and CEO of AHS, and she's going to give more details on today's announcement, as well as an update on capacity in our acute care system, our hospital system here in Alberta. I want to share some new steps that we're taking to increase healthcare system capacity in order to deal with the fourth wave of COVID-19 here in Alberta. The Delta variant is continuing to put significant pressure on our healthcare system. And Alberta's government is working to relieve that pressure by freeing up beds and freeing up resources to deal with the rise of inpatients needing care. Today, we're adding resources for home care and more supports for residents in our continuing care facilities, with the goal of moving patients out of hospital and into more appropriate care settings. Now, first, I'm pleased to announce today that the government of Alberta will provide an additional $22 million over 2 years to increase pay for certified healthcare aides who are working in contracted home care agencies. And this is going to support retention of current staff and as well help to attract new people and increase capacity in our home care system in Alberta. As well, healthcare aides, it should be noted, are the core workforce in continuing care, including both home care and facility-based continuing care. They're skilled staff, and the work that they do is essential to the well-being of their clients and the residents that they serve. More than 27,000 continuing care residents at any given time, and 140,000 home care clients in a given year. And they've been truly on the front line of the pandemic, along with the staff in hospitals, as well as our family physicians and other health professionals. They've come to work through the pandemic and done everything that they could for their clients and their residents, as always. Second, we'll provide $14 million to support short-term staff increases in home care agencies and our continuing care facilities. Now, we know that home care agencies and our continuing care facility operators continue to face staffing challenges. And with this new funding, AHS will work with operators to find new ways to make staff more available and add new staff where they're most needed for short periods of time. And this important program will increase capacity to handle things like increased cleaning and screening in facilities and respite care and other supports for families of home care clients. Increasing staffing will mean that we can move more patients home from the hospital when they are ready. And that's better care for the patient, because the hospital is only the right place to get care as long as you really need to be there. And it's better for the system and for other patients because it frees up opportunities for a bed for the next patient who needs it. The steps that we're announcing today are just short-term pieces of a much larger effort to modernize our continuing care system. And that effort is guided by the facility-based continuing care report, which we released back in May, if you remember. And the review looked at how we can build on the best aspects of our continuing care system. It also took a look at what we could learn from the pandemic and the toll that it had taken on residents, on families, on staff, and the staff and the operators as well in these facility-based continuing care settings. We know that there's a lot of work ahead of us, but with the fourth wave surging in the healthcare system, coping with this fourth wave, now is the time to move ahead with some of these important measures that will improve capacity immediately. Now, the report from May, this report laid out some ambitious goals, starting with putting quality of life at the center of the system for continuing care, and improving staffing in home care and facility-based continuing care. What that means is that we can add capacity right now to help the system respond to the pandemic. And I want all Albertans to know that the government is exploring all options to ramp up our capacity at this time. And before I turn it over to Dr. Hinshaw, I want to express my personal condolences to those Albertans and their families who have had their surgeries postponed. No one wants to see that happen. but it's a step that AHS needs to take to free up capacity to get through the peak in demand. And as they've done before throughout the pandemic, and other jurisdictions have taken similar measures, AHS will be working to ramp back up and get those patients rebooked as soon as possible. Thank you very much. I'll now turn the podium over to Dr. Hinshaw to provide us with an update on the current COVID situation here in Alberta. Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. Before I begin today, I would like to talk about pregnancy and vaccine. Pregnancy is an exciting but stressful time for parents, and it can be overwhelming to sift through an endless amount of often conflicting information of what to do in the best interest of the health of their unborn child. COVID-19 has not made this any easier, and I know there is a lot of misinformation circulating about whether those who are pregnant or trying to become pregnant should get COVID-19 vaccines. I would like to be clear that there is no evidence of harm from mRNA COVID-19 vaccines for those who are pregnant or breastfeeding. The National Advisory Committee on Immunization and the Society of Obstetricians and Gynecologists of Canada recommend that those who are pregnant get a complete series of vaccine. This is because those who are pregnant are at a high risk of severe outcomes due to COVID-19. In August alone, 6 pregnant Albertans were admitted to ICU due to COVID-19. All of them were unvaccinated. To put this into context, only 7 pregnant Albertans were admitted to ICU for COVID during the entire first year of the pandemic from March 2020 to March 2021. In the 6 cases we saw last month, not only has COVID had severe impacts on the parent's health, but also the child's. 5 preterm births occurred as early as 29 weeks. If you are pregnant, trying to become pregnant, or have recently delivered, please get both doses of COVID-19 vaccine as soon as possible to offer you and your family the best protection possible. I also want to be clear that there is no evidence that COVID-19 vaccines cause fertility problems. Studies evaluating male and female fertility metrics after COVID-19 vaccines have not identified any harms to reproductive health, so COVID vaccine is also a good proactive step to take even before pregnancy. Turning to today's update. Over the last 24 hours, we have identified 1,510 new cases and completed about 13,800 tests. Our positivity rate was 11%. Currently, 679 people are admitted to hospital for COVID-19, including 154 in the ICU. Sadly, I must also announce that 9 new deaths were reported to Alberta Health in the last 24 hours. My thoughts go to the family and friends of these individuals and anyone mourning a loss. We have seen many more deaths recently, which reinforces how seriously we need to take the current situation. It is to prevent outcomes like these that immunizations are so important. I know there has been concern lately, noting that some of our deaths have been in people who are fully immunized, and I want to be clear that vaccines are still making a profound difference. Vaccines, like all other medical interventions, are not perfect. What they can offer, however, is a high level of protection against infection and an even higher level of protection against severe outcomes. In the last 4 months, 84% of all those who died from COVID-19 have not been fully immunized. Unfortunately, we are seeing a small number of breakthrough infections in those who have been fully immunized, and some of these people have gone on to have severe outcomes, including death. The majority of these severe outcomes have been in those who are older, have multiple medical conditions, and this is why we have implemented a 3rd dose for those with immune-compromising conditions and for all residents in seniors' continuing care facilities. Even without a booster dose, however, vaccines are still very powerful. In the past 2 months, no fully vaccinated Albertan under the age of 60 has died. For those 60 and over, Albertans who don't have the protection of 2 doses of a vaccine have a 14 times greater risk of dying from COVID than those who are fully immunized. In addition, looking at our current ICU and non-ICU hospitalizations, 91% of those in the ICU are not fully immunized, and 75% of those in hospital outside the ICU are not fully immunized. Clearly, vaccines are one thing we know that can limit new cases and help to prevent severe outcomes, long COVID, and hospitalizations over the long term. Simply put, we need more Albertans to get immunized. In addition, we need to work together again in other ways to bring down COVID transmission in order to protect our healthcare system and our communities. On Friday, as you know, changes to masking and liquor service were announced, and recommendations to work from home and limit indoor gatherings were made. I would like to be clear that these measures also mean that changes that were planned for September 27th have been postponed as well. We received many questions over the weekend, so I would like to clarify what remains in effect. Masking is mandatory in all indoor public spaces and workplaces. This also extends to continuing in acute care, public transit, taxis, and ride shares. Isolation is still legally required for people who have COVID-19 symptoms or have tested positive. And I would like to assure Albertans that we continue to closely monitor COVID-19 activity to determine the impacts of the measures put in place several days ago. AHS continues to do case investigations for all cases, meaning notifying anyone who tests positive, asking that those individuals share this information with close contacts so they can monitor for symptoms, isolate if necessary, and contain the spread. In addition, AHS continues to notify locations where transmission seems to have occurred due to clusters of cases with a common location identified, and contact tracing has continued in high-risk settings, such as acute and continuing care facilities. I know there has been concern about the ending of universal contact tracing at the end of July, and questions about the impact that this change has had on our spread. I want to be clear that the work of contact tracers has been invaluable throughout the pandemic, and before widespread vaccine availability, it was the cornerstone of our response. Contact tracers should be proud of what they accomplished in extremely difficult circumstances. It is also true that the impact of measures like contact tracing changes over time. The question that was facing us earlier this summer was what measures were needed in the context of high vaccine availability and coverage rates. We knew that cases would rise with general public health measures lifted, and anticipated at that time that the acute care impact would be limited. We also knew that cases would have much higher numbers of close contacts than they had during the time with public health measures in place. And only unvaccinated close contacts were required to quarantine, which was the minority of the population and therefore the minority of close contacts. We knew that the only actions required from contact tracing would be quarantine of a smaller and smaller proportion of all contacts. And given all of that information, it was my recommendation to move away from universal contact tracing and to focus instead on case investigation and high-risk setting, contact tracing, and outbreak management. To assess the impact of moving away from universal contact tracing, it is interesting to note that earlier in the summer, Alberta, BC, and Saskatchewan all moved to eliminate almost all public health measures, with the common expectation that any increase in cases would be decoupled from severe outcomes, even with the Delta variant. Per capita, our cases increased in almost identical ways, and although BC and Saskatchewan did not change contact tracing, only BC has seen a decrease in transmission trends in areas where public health interventions were reinstituted. Although Saskatchewan continued its contact tracing program and we have not, Alberta and Saskatchewan's per capita cases, hospitalizations, and ICU admissions are trending equally. Universal contact tracing was critical earlier in the pandemic, but we must continue to assess our approaches based on our evolving context and best current available evidence. Our current focus is on case investigation, mandatory isolation, and high-risk contact tracing as the greatest impact areas. I also want to speak briefly today about the use of modeling in our planning. The models we released last week have informed part of our thinking and planning, but have not been the only piece of evidence we relied on. Models are valuable to look at the probability of different scenarios, but are not meant to be a precise prediction of the future. The models that our teams ran in June showed results that are very similar to the internal modelling that BC just released that was done at the same time. The assumptions at that time included increased transmissibility of the Delta variant, as well as the impacts of removing public health measures in July. We anticipated that cases and acute care impacts would rise somewhat over the summer, and the modelling helped us track our actual cases against what was expected. This meant that in early August, we were able to pause the second step of our move to endemic COVID management based on an unexpected increase in acute care impact that was different from the trajectory that had originally been anticipated. Our models were updated to take into account the Alberta-specific data, resulting in the second set of models that helped inform our need to bring in additional public health measures. I know there have also been questions about why we used the UK data as a comparator. I want to be clear that as we looked at jurisdictions experiencing Delta spread at the same time we were doing forward planning, in early July, the UK was one of the few jurisdictions that had similar overall vaccine coverage, had also used the lengthened interval between first and second doses of vaccine that has now been shown to increase protection levels, and also had a high Delta circulation at that time. There has never been one perfect way through this pandemic, and it has always been critical to adjust our approach based on the information available at the time. This is what my team and I continue to do through close monitoring of the data and adjusting recommendations as needed. We are in another difficult time in the pandemic, with many dissenting opinions and a lot of anger and fear about the current state. I want to remind us all right now, as always, that kindness matters. This is no small thing. Respectful dialogue and choosing to be compassionate to each other as we face this current situation has never mattered more. Thank you, and I'll turn the podium over to Dr. Yu for her comments.
Good afternoon. Thanks, Deena. Thanks to Minister Shandro for today's announcement to help support the continuing care system, including home care, supportive living, and long-term care in Alberta. This is welcome news and very much appreciated. Giving home care agencies the resources they need to allow for the hiring and retention of more staff will help more Albertans receive care at home when possible. Quality care in the most appropriate setting. It will also help us get people home and preserve space in the acute care, especially as we see the number of COVID-19 admissions rise. Home care has faced staffing challenges throughout the pandemic. We saw a temporary reduction in the number of clients receiving home care last year because of COVID-19, which meant staff worked less hours. Some moved on to other jobs as a result, and filling these positions has proven difficult as the home care demand increases again. The wage supplement for home care healthcare aides will assist home care agencies to fill these positions again and extend the number of hours available to support Albertans. Healthcare aides in long-term care and designated supportive living have already received the supplement last year. This increase will help home care be on a level playing field for the home care aide workforce. This funding, as mentioned, will enable home care agencies to take on more clients, which will expedite the discharge of patients currently waiting in hospitals who can be supported at home with home care. In addition, we are looking at different strategies to increase the number of staff available to support clients, including hiring healthcare aides who may not yet have completed their certification but can provide care under supervision while they do so. There are many tasks that can be performed by individuals who are not certified healthcare aides to help people thrive at home. Innovative strategies will also be required to increase the pool of certified healthcare aides available across continuing care, including home care, and we will explore both local strategies and those used in other jurisdictions to increase the number of available staff. Our priority is to provide safe, quality care to Albertans in the most appropriate setting, whether that is in a hospital, long-term care facility, designated supportive living facility, or in their own homes. It is initiatives like these that enable us to continue to provide the highest level of care and support to Albertans. I'd also like to provide an update on hospital capacity. Our provincial healthcare system is experiencing significant capacity challenges. We continue to do all that we can to increase capacity, particularly in our ICUs where pressure on our staff, physicians, and resources is intense. This afternoon, our ICU capacity is at 87% of all our capacity, including the surge capacity that we have created to date. There are 231 people in ICU. About 70% of these patients have COVID. In the past 7 days, we have added an additional 59 surge beds. We now have a total of 93 surge beds above our baseline of 173 ICU beds. So although we state that we are looking at a current capacity of 87%, remember that this includes surge beds. If we did not create the surge beds, we would be at over 130% capacity. So again, thank you to our nurses, physicians, and all the healthcare team members for helping create these additional beds, which have given us some much-needed breathing room. I cannot overstate enough our gratitude for our people who continue to work tirelessly 18 months into the pandemic. In the face of rising numbers of patients with COVID needing hospital care and our ongoing efforts at the same time to meet the needs of patients who need other non-COVID care, we have to continue to take every possible measure in order to maintain our ICU capacity and increase it wherever possible. And unfortunately, this means that we have to postpone surgeries. Yesterday, Calgary Zone made the difficult decision to postpone all scheduled elective surgeries and many outpatient procedures for the remainder of this week. This includes some non-urgent scheduled pediatric surgeries. We're also having to postpone some non-urgent transplant cases and a small number of cancer surgeries that can be safely delayed for a period of time due to the stage and nature of the particular cancer. These may include low-risk diagnostic cancer surgeries where cancer is suspected but not confirmed. These decisions are clinically based, using a triage document written and approved by physicians and clinical cancer leadership. As is the case with all surgeries, clinicians triage cases based on priority. The most serious and urgent cases are performed first. This has happened in previous waves and is standard in every healthcare system in the country. My heart, though, goes out to the patients and their loved ones, because we know it is not easy when you get the call that you need a postponement. The pandemic is having a significant impact on many Alberta patients, not just those with COVID-19. I want to explain why we have to postpone surgeries. Some patients will require intensive care after their surgery. They may have to spend a couple of days in ICU as they recover so that our frontline teams can monitor them and keep them well. This happens in both planned and unplanned ways. We currently just don't have the capacity to provide that care, while also ensuring we have the capacity to look after patients who are very ill with COVID-19, as well as patients who suffer a trauma of some sort, such as injuries from a car accident or emergency like a heart attack or stroke. So we have to postpone non-urgent scheduled surgeries to ensure that we have the space, the staff, physicians, and resources we need to care for those who need it. Postponing elective surgeries allows us to redeploy qualified staff to support intensive care and critical care beds. Healthcare is a finite resource, and we need the help of all Albertans to protect it. The key to easing this situation and returning to normal surgical levels is reducing the pressures on our hospitals. And the key to that is actually known. We need to do all we can do to protect ourselves, our loved ones, and our communities by getting immunized and following all COVID restrictions and guidelines. That means wearing a mask in the public indoor setting. It means staying home and away from others when you feel sick. It means washing your hands regularly. These are the things that will protect our healthcare system and help return us to a place where we don't have to postpone surgeries. The power of the vaccine is clear. Of the 155 patients with COVID currently in ICU, 89% are either unvaccinated or partially vaccinated. I recognize that getting vaccinated is a charged topic right now, and that there are many reasons people have, to this point, chosen not to vaccinate. If you have concerns about being immunized and need more information, we have many experts who can help you with factual information. You can contact us at 811. If you don't want to get immunized in order to protect yourself, please consider getting immunized to protect others. Thank you very much, and I'll pass it back for questions.
Thanks, Dr. Yu. Thanks, Dr. Hinshaw and Minister, for being here. We've got to try to wrap by 4:15, and there's a lot of pieces today. We have reporters waiting in Calgary, on the phone, and here at the Fed building. I think the reporters in Calgary do not have questions, so it's just phone and here in the room. So please limit yourself to one question and one follow. Please be as quick as you can. We'll start on the phone for two, and then back to the room for two. So first caller, please.
First is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my question. This is for the Minister. Minister Shandro, you announced like $36 million in funding today that's largely for continuing care. Can you explain how this will help the immediate crisis in ICUs, in canceling surgeries, and in filling hospital beds? What does this do right now?
Good question. And what it does is it allows us to have that further capacity by those who have the opportunity, when it's safe, to be able to continue their care in their own home rather than in a hospital bed. And so that it allows us to increase our capacity in our hospital settings. So, Dr. Yu, any further context you could add to this question?
Certainly. We have about 400 patients right now in our acute care system who actually could potentially go home, either to a long-term care setting or actually to their home setting. So by providing this incentive funding and having more home care staff, we're hoping that we can actually improve the flow within the hospital to allow for increasing the capacity.
Thanks, Dr. Yu. Follow, Carrie?
Yeah, I do have a follow-up question. So 400 patients is a lot, but it's not like hundreds of them or even dozens of them are going to be discharged next week because of this funding. I understand that that's how it will work, but I'm wondering, how will this work now in the immediate crisis?
Sure. Well, Dr. Yu, maybe, again, back to you to provide further context on, and let me say as well that this is one of the opportunities we have to be able to increase our capacity both immediately as well in the medium term. But Dr. Yu, further context from you on how this helps immediately.
Yeah, so I mean, immediate things that we're doing right now to help create capacity is doing what we're doing, which is around postponing and delaying surgeries. That creates immediate capacity for me. In terms of the 400 people that actually could potentially move out of hospital, these are what we call the ALC clients. We actually do have ability to actually move about 200 of them into continuing care spaces in the next week or two. So there is some immediate capacity that we can create. I just want to stress right now that we're very concerned about our ICU capacity. That is our number one challenge and our number one issue. We have been able to create capacity in our inpatient settings. So I think we do have some time to work on the incentive funding to create that additional sort of medium term, as the minister said. But right now, the immediate attention is to ICU, and the bulk of that work is really around the postponement of procedures and surgeries.
Thanks, Dr. Yu. We'll take the second caller on the line.
Next is Bill Fortier with CTV News. Go ahead, Bill.
Hi, the question is for Minister Shandro. We just heard from Dr. Yu that capacity is the number one challenge. Well, it's extremely clear that hospitals are crowded because of unvaccinated people primarily. Nearly 90% of people in the ICU are unvaccinated. Why isn't it time, and when is it time, to limit their ability to spread COVID by limiting where they can go and spread COVID with a proof of vaccine mandate in places like restaurants, like most provinces, almost every province now is either doing or planning to do or at least talking about doing?
That's a great question, and I think it's unfortunately not an easy answer, but I think that's why the largest employer in the province, AHS, has moved forward in showing that leadership and what other workplaces can do and what other employers can do. The steps that they've taken for requiring vaccines, the same as they require already for the workforce to have vaccines for measles and other communicable diseases. But to be able to move forward with those types of opportunities for it to there, and we are moving forward as well, as Premier said last week, with our own provincial QR code to help facilitate how quickly Albertans can show their immunization status if they choose to do so to folks who wish to make the decision about patrons or employees who are in their businesses to be able to show that quick status update for the immunization status, as well as the other steps that we're taking to be able to allow, for example, for large events who are making that choice with the printable card that will be coming out in Alberta shortly in mid-September, but as well that the QR code as well that we're working on, and to be able to help Albertans who are making that choice for those opportunities to do it fast, and for Albertans who want to have that the power and the of showing the status of their immunization in the palm of their hands. We're going to continue to make sure that Albertans have that in the palm of their hands.
Thanks. Follow-up, Bill?
Yeah, the follow-up is also from Mr. Shandro. Following on businesses and sports teams who are making these decisions themselves, a lot of people are saying you're basically just not making the tough decisions, you're making them make the tough decisions. Respectfully, there are still plenty of places where unvaccinated people can go and spread COVID. Why are you not limiting that right now?
Well, I think we are in what we announced last week by advising those who are unvaccinated of the danger to themselves and those around them who are also unvaccinated, and to limit their household contacts. A lot of the transmission for those who are unvaccinated is in indoor settings. And for those folks who are making the choice right now, unfortunately, to not be vaccinated, that they need to limit their indoor their contacts for indoor social settings to two families, maximum 10 people, is precisely because of that. So we are making those recommendations because those folks are putting themselves at risk, as well as their other family members. And we are continuing to look at other ways in which we can continue to increase our vaccination rates in Alberta, and other ways in which those who are unvaccinated are putting themselves at risk, and a significant amount of them ending up in our acute care system, and putting pressure on AHS to be able to respond to those numbers. So we'll continue to look at that evidence and look at what options we have available to us. Thank you, Bill.
Thanks, Minister. We'll come to the room here in Edmonton for a question at the mic.
Hi, Minister. It's Michelle Bellefontaine from CBC. I just want to follow up on the questions that Bill just asked you on the vaccine passports. You said that it's not an easy answer. Well, a lot of people would argue it is a pretty easy answer, especially when you look at the evidence that's happening from other jurisdictions that saw their vaccination rates, including Ontario, saw their vaccination rates more than double. So can you explain to Albertans why this is not an easy answer?
Yeah, I can. And it's a good question, Michelle. Good question. And we are continuing to look at that evidence from other jurisdictions and what our opportunities might be here in Alberta. But we have seen businesses take that first step, that leadership role in implementing requirements for their own businesses, for their own events, for their own workplaces. Our commitment is to Albertans to continue to make sure that they have the power of showing their immunization status in the palm of their hand or in their wallet and printable card. And we're going to continue to do that. Why is it not an easy decision is quite frankly because of the many different circumstances we see where COVID is spreading right now in the province. The disparity as well in vaccine rates among certain age groups and geographic areas in the province. And so this is some of the work that we are doing with our public health officials to be able to understand what our opportunities are going to be here in Alberta. But no, fantastic question, Michelle.
Follow?
Yeah, I have a follow-up, another good question for you. How much are political considerations playing into this? That members of your own UCP caucus have pushed back against vaccinations, against masking, against any kind of restrictions. So how are members of the UCP caucus informing how you are protecting the health of Albertans?
Well, Premier and I have said throughout the last 18 months that we are going to be making decisions that are based on public health and not making these decisions political. And I think, quite frankly, the biggest criticism of us over the last 18 months is that we have not been making our decisions political enough. And we're going to continue to do that and continue to work with Dr. Hinshaw on what our opportunities might be for Alberta to be able to respond to where we are seeing cases. And that means geographically, but it also means demographically as well. And in particular, I'm thinking about those who are between 20 and 49 whose vaccine rates are much lower than what we see in age groups above them. And the work that needs to be done here in the province to increase those vaccination rates in those geographic and demographic areas, and where we're seeing transmission in those for those folks, in which settings, and what further work needs to be done in the province to be able to address that transmission. Okay. Thank you, Michelle.
Thanks, Minister. We'll stay in the room for another one. Janet?
Hi, it's Janet French from the CBC. I just wanted to follow up on your answer to Michelle's question. When you're talking about a vaccine passport not being an easy answer, I mean, what makes you think that it would be less effective in certain age groups, demographics, or geographical areas? What evidence are you relying on to come up to that conclusion?
And just to be clear, when we talk about vaccine passport, you're talking about a government mandate for vaccines to be in a certain setting. Just because I know that there's so many Albertans who have different definitions of vaccine passport. A lot of them do think that the having your accreditation in the palm of your hand, like it is currently already in My Health Records for the mobile app, understanding that there's more that we could do to make it easier for access. But some folks think that's a passport. But you're talking, Janet, about a government mandate for vaccines in certain settings?
Just want to shift gears. I have a question for Dr. Hinshaw.
Oh, do we miss that? Was there a delay in the line or something like that?
No, I think we're good, Minister. We're just switching over to Dr. Hinshaw.
Oh, sorry, you were waiting for a definition of vaccine passport?
No, I was just making sure that we were on the same page for that definition, Janet, I suppose. But that's what you're talking about?
Yeah, I think so. So, Dr. Hinshaw, you have acknowledged that some of your early summer decisions and modeling and assumptions were not the greatest. You've twice had to push back your dates for isolation requirements and mass public testing. You were nowhere to be seen for several weeks in public while cases were rapidly rising in Alberta. All of this happened while other medical experts were raising concerns about what was going on. I mean, why should Albertans or the government still have confidence now, given what we're seeing in hospitals and ICUs? Confidence in you, I should say.
Thank you. And I think it's an important question regarding trust. Trust is not something that I have control over others. And so people will have to choose, again, as they always have, who they want to put their trust in. What I have always done is, at every step along the way, I have looked at the evidence that's been available to me. I've consulted with colleagues. In early summer, I did recommend that we move to endemic, partly in consultation with colleagues who are doing similar policy changes with respect to removing public health measures, considering an easing of how we approached COVID, allowing cases to rise with an expectation that hospitalizations would be decoupled. And so again, that recommendation was based on what I had available to me at that time, and based on my belief that that was in the best interests of Albertans in terms of their overall health. Clearly, the move to endemic was too early. We saw early signs of that in early August when we did see trends that were not the same as what our modeling predicted. So the modeling helped us to be able to see that decoupling was not happening in the way that we had anticipated. And we were able to then move the changes later to be able to have more monitoring time. We continued to see that rise, and then I was able to alter my recommendations based on that evidence at that time. It is, of course, up to Albertans to determine where they want to put their trust. All I can do is continue to show up, to continue to do my best every day with my professional judgment, looking at the overall health of Albertans, COVID impacts, the impacts of restrictions, as well as the impacts of many other health issues that Albertans face. And it will be up to Albertans and decision makers to choose how they wish to work with me, but I continue to be committed to the overall health of Albertans and will continue to do my best every day for the province and for the people of this province.
Thanks, Dr. Hinshaw. We'll go back to the phone with one, and then back to the room.
Yeah, Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Minister Shandro. I'm so confused this afternoon, but that's probably just me. I'm going to make these two questions really, really, really simple. In your estimation, how much longer is this wave going to continue to climb? How bad do you believe it will get? And what measures are you prepared to put in place if things get much worse? In other words, are you ruling in, ruling out, still considering, not considering government-mandated vaccine passports, not businesses having, checking people in and out, government-mandated vaccine passports, closing of businesses if things get worse? What is on the table? What is off the table? Where are we going here, and how bad could it get? Question one.
That's just one question, Rick. I'll break it down because I think there actually was more than one there. But let me say to begin with, I think you're asking about timing in the future. And as we've seen over the last 18 months, is that no jurisdiction has been able to predict the future. And we're in a similar situation. We do have our modeling on the website, so it is public. And we are at this point, and let me say, I mean, no model is a prediction of the future. These are estimates of where things might be going in the coming weeks. As you go further out from today, some of those I guess the numbers in that modeling are harder to be able to pin down. But I think right now it is showing from that modeling that we might be seeing peaks coming in the coming weeks. Some asterisks, though, to put beside that modeling, as we continue to see those who are unvaccinated continuing to interact with each other and to be able to guess those folks and their behavior does make it a little bit difficult for us to pin down. But that information is on the website. Your second question was about what is to be done. Right now, we've implemented a requirement for masking for us to be able to flatten the curve, as it were. I know that people were sick of hearing that term in 2020, but that's the case. That we are looking to. We know that the area under the curve for those who are unvaccinated is an area under that curve that we would like to see stretched over time to be able to help with our acute care hospital system capacity and hopefully have further opportunities to encourage those folks to get the vaccines that they need to be able to protect themselves and those around them. And so after that announcement last week, as I've said before, I mean, we're looking at the further situation as I think I can't remember if it was Janet's or Michelle's question, but looking at where we do see the further spread among the geographically and demographically for us to be able to continue to make sure that we have the system capacity in our hospitals that we need to have.
Okay. Thanks. Rick, maybe you could choose either the minister answer the third question in your first question on passports or put a follow-up, a quick one.
Okay. Yeah, I mean, I'm taking the shotgun approach because it's hard to figure out. I mean, with all due respect, it's hard to figure out your answers. It's hard to get an answer. I guess what I'm saying is people are upset. They want to have an idea of what the government's plan is, very clear plans, and they'd like to know, are certain things still on the table or are they definitely off the table? In other words, government-mandated vaccine passports. Is there a possibility you'll bring them in? Is there no possibility? Is there a likelihood? Would you be prepared to close businesses again there's a lot of people listening here who are in businesses. Are you prepared to close businesses again if it gets bad enough? So I think I'm being pretty direct. Some people want to know about government mandated passports. Some people want to know about closing of businesses. Are they on the table or off the table? Thank you.
Well, Rick, I think the core of both those questions was how certain can we be of the future? And people are expecting certainty, and they want certainty now. They want us to commit to an answer to a particular question, and you had a couple there. And why can't we say that the future is definitely 100% going to be one way or the other? And I know that's been a question that I've received many times over the last 18 months, but it's also a question that people throughout the world have had of their governments. They've wanted to know, you said this was going to happen this way, and it didn't. And it's been because this is a pandemic that quickly changes, and government responses have to quickly change. And I know that that's frustrating because you want 100% definite answers to the questions. And the future of the pandemic continues to change. And so that means that it's difficult for us to say 100% we know that the answer for the next X amount of time is going to be one way or the other. We have made it very clear, though, that we knew that cases were going to increase. As Dr. Hinshaw said in her opening remarks, that we knew that cases were going to happen as a result of the Open for Summer plan and the removal of public health care measures that other provinces and other countries also did. And we were expecting to have a decoupling from hospitalizations. And right now, with the disparity in demographics for vaccine rates, in particular among the younger folks, and concentrations of unvaccinated in certain parts of the province, geographically too, that we didn't have that decoupling. And that's been frustrating for Albertans, in particular those who are angry because they did the right thing. Here in Calgary, we've got 84% of adults who have done the right thing and gotten vaccinated, and they're frustrated that we still continue to see folks ending up in a hospital when they haven't done the right thing and gotten vaccinated. And that's incredibly frustrating for those folks, and they want to know where we're going. But what I can say is, again, we've got our modeling that's posted on the website. We will have to continue to update modeling. We'll have to continue to update our responses to COVID to be able to respond to a pandemic that does continue to change, not just here in Alberta, but everywhere throughout the world. Thank you, Rick.
Thanks, Minister. We're over time, but I think I committed to one more in the room. So, Lisa, if you can just be as quick as possible.
Great.
We'll take
Thanks,
one last one.
It's Lisa Johnson from the Edmonton Journal. I'm wondering that Friday's announcement frustrated and definitely confounded a lot of people in the hospitality industry. So I'm wondering if you can be specific, Minister and Dr. Hinshaw, what data suggests that alcohol consumption after 10 p.m. will curb this fourth wave of COVID-19 in a significant enough way to help hospitals get through this crisis?
Sure. Maybe I'll start off, Dr. Hinshaw, and then pass it over to you. I guess I would start off by saying it's first looking at the vaccination rates demographically, that those who are younger, but as well as the on the ground experiences of our public health officials who we're seeing the transmission among the young and where they have been in the 2 weeks before before their infection, and some of the behavior that the unvaccinated had been participating in before they became infected. But Dr. Hinshaw, any further info you can provide to that answer?
Sure. So it's clear from our data that, again, the highest transmission rates are in those who are younger, which isn't their fault. This is an age group and a demographic that typically part of that developmental process through adulthood is spending time with friends, socializing. So this is not to blame those individuals, but to indicate that clearly that particular demographic and that younger adult age group is a huge part of what's driving transmission right now. We know that the places where transmission likelihood is highest are indoor spaces that have many people together, that are not masked, that are participating in activities such as dancing, so thinking about a nightclub where people are in close proximity, that we know that as people use alcohol, they become more disinhibited. And so what we saw previously in previous waves was that while people may try to follow certain measures or restrictions or spacing earlier on, that becomes less and less likely later on as people have been drinking and are less likely to be prioritizing those COVID precautions. So we looked at the experience of other countries as well as our own, and what we know about COVID transmission, which is that these types of settings where we have large numbers of people in the demographic that are at the highest current driving group for the transmission of COVID-19 in the province, where you have many people together in close proximity, using alcohol and disinhibited is a concern. And again, this is one measure that we can take to minimize those kinds of interactions, as well as, again, mandatory masking and reminding Albertans that we're in a very challenging time, and we all know, every one of us knows what we've needed to do throughout the last year and a half. And so all of us know that staying home when sick, making sure that if we're in a public place, we're wearing masks, staying distance from others outside our household, those are basic things that all of us can do. This one additional step was added to that list of measures to, again, minimize the risk in some of these very high-risk establishments.
Thanks. Follow, Lisa, and then we'll wrap up.
Thanks. Yeah, and just to follow up on something, Minister, you mentioned earlier, we've seen you kind of applauded businesses for taking a leadership role. A lot of people are wondering how it's fair, for example, a restaurant in Edmonton that might require proof of vaccination for somebody to come into that restaurant, dine in that restaurant, drink in that restaurant. Why would that restaurant be punished with a 10 p.m. curfew on liquor sales, which will affect their bottom line, when they've been stepping up in that leadership way? And I'm sure a lot of people would also wonder why rodeos are being given exemptions when people who are taking specific leadership steps to curb the spread of COVID-19 are being punished by some of these rules.
And a good question. We've had that that feedback from folks in the hospitality industry, and we have committed to them. We'll continue to work with them on this issue, what was announced on Friday, and to be able to ensure that, to the best that we can, that measures that are implemented in this province are considering their feedback, and they've been helpful and very vocal advocates for their industry throughout the last 18 months, and we want them to continue to be at the table, giving us their feedback to be able to help understand what we can do to work with them. So it is a good question, and we have heard that from them as well. Our commitment is just to be able to get that feedback and work with them on this measure, but also going forward as we make sure that we get their feedback.
Okay, we'll wrap it up there. Thanks, Minister. Thanks, Dr. Hinshaw. Thanks, Dr. Yu. I'm sorry we were not able to get to everyone. We had some people waiting online. As always, please feel free to follow up with me or AHS or the Department of Alberta Health. Thanks very much, everyone.